Hello and welcome to the continuation of your Chapter 13 lecture. In this video, we are going to cover Section 13.3 on circulation and the central nervous system. So the way we are going to get our arterial supply is by having a blood-brain barrier to make sure that certain toxins are not going to get into these wonderful arteries that we see here. And note that there is a unique arrangement here carrying the fresh oxygenated blood to the brain. There are multiple routes of this blood to get to our central nervous system, so the brain will always get uninterrupted perfusion. Mainly we will have the vertebral arteries here bringing in that blood, as well as through our internal carotid arteries here. We'll also have a special feature of being able to filter the blood into cerebrospinal fluid, or what we call CSF, which then is going to circulate through the cavities of the brain and spinal cord in areas that we call ventricles. So first, let's take a look at that circle of Willis. This image over here is supposed to give a visualization of the circle of Willis here, or we could also call this the arterial blood supply to the brain, or the cerebral arterial supply, or cerebral arterial circle. Lots of different names for this. So we'll start off with the vertebral arteries. That's where we're going to have the two arteries. I'm just going to go back here, moving up the alongside the spinal cord and then up along the medulla, and then they will come together in anastomose right at that base of the pons. So let me go over here, and where the two vertebral arteries come together, again, there's an anastomosis, and we are going to create our basilar artery here at the number 2 that overlies the pons. Then we are going to swing on back to give supply to the posterior aspect of the cerebrum. So we're going to naturally call these the posterior cerebral arteries. Then extending anteriorly, we are going to have our posterior communicating artery. It was called this because we are now communicating some blood over to the other arteries that we see here. Here at the number 5, we see the internal carotid arteries. The blood here is coming from the area of the neck. Mainly this artery branches off of that common carotid artery that we find in the neck. And then we are going to branch off to become the middle cerebral arteries. So this artery will of course supply the middle cerebrum and will sit within the lateral sulcus of the cerebrum. And lastly, but actually not lastly, but the last main artery we're going to talk about is going to be the anterior cerebral artery here that will supply the anterior cerebrum, and this will branch anteriorly in order to supply, or not supply, but rest within the sagittal fissure, and will kind of wrap around that anterior corpus callosum area. And then we have a teeny tiny artery in the middle here that connects those two anterior cerebral arteries, and that little branch between, or bridge between those two, is called the anterior communicating artery. So what are we going to do in order to pull our deoxygenated blood away from the brain? We know that we use up that oxygen in our tissues, and then our low oxygenated blood is going to return to circulation through a series of what we call dural sinuses and veins. And you could see them outlined here in the blue. We have a couple important ones. One is going to be this superior sagittal sinus that is running in the groove of the longitudinal fissure or sagittal fissure and will absorb the CSF, cerebrospinal fluid, from the meninges. And then what it does is it swings on back, as we see the arrows pointed here, to an area called the confluence of sinuses, basically where all these sinuses are kind of meeting together, along with our occipital sinus, which we see down over here, and the straight sinus, which is going straight back. If you look over here, you could see we have a They don't have this, oh, they do have it labeled. This is your inferior sagittal sinus, so that drains the blood back into the straight sinus, which then takes it to the confluence. And then from these areas, all of this blood is coming to the confluence. And from the confluence, we are now going to move out laterally. So I'm going out to the side over here, and this is now called our transverse sinus. The transverse sinus will connect to the sigmoid sinus, and then we'll take that down to the internal jugular vein, which continues down through the neck and will eventually meet up with the subclavian vein to become the brachiocephalic vein, which will then drain into the superior vena cava, taking it to the heart, specifically at the right atrium. And here are just a couple different visuals of these sinuses. So I'm just going to highlight some of the more important ones we talked about. That superior sagittal sinus, which meets at this confluence, right? We also had the transverse sinuses that would extend out laterally. And then that straight sinus was draining straight back to the confluence as well, right? And of course, there was that inferior sagittal sinus that first drains into the straight sinus to take it back to the confluence. Here's another view. So there's our superior sagittal sinus. We see that it's found on the external border of what we call the falx cerebri. We're going to talk about that dural fold here in just a moment. Then we've got our straight sinus going laterally. Did I say straight sinus? I meant transverse sinus laterally. And then we have our straight sinus over here. Note how it's at the base of the posterior falx cerebri. And here's a superior view of the cranial cavity. The brain, of course, has been excised here. And you can see here that we left a little bit of the dura mater in place. So the superior sagittal sinus at this point is actually coming out toward you through your computer screen toward you. We don't see the whole thing, of course, but that's its opening. That is going to have it meet at the confluence. And then going out laterally here, we have the transverse sinus, which would then lead to that sigmoid sinus and eventually the internal jugular vein. And we could see that the transverse sinus here is sitting at the external border of the dural fold that we call tentorium cerebelli. And then lastly, we have our straight sinus. So this is just going straight back to meet the superior sagittal sinus at the confluence. All right, let's talk about those meninges that I kept mentioning. First, we have our dura mater. This will be the most superficial layer. And then we have our arachnoid mater, which is going to be more of a, it doesn't really look like it in this picture, but it's more of a like cobweb, saran wrap type of looking tissue. Arachnoid means spider, so it kind of looks like a cobweb over the brain. And then lastly, we have the pia mater. And the pia mater, if we take the spider web arachnoid mater away, the pia mater cannot be taken off of the brain. It's tightly adhered to it. And I'll show you the difference between those two in lab. And then we have some spaces. So below our dura, we are going to have a space called the subdural space, which is going to contain some serous fluid. And then we also have a subarachnoid space that is below the arachnoid mater that is going to contain our cerebrospinal fluid. So that cerebrospinal fluid would be sitting right along in here. All right, so why do we have these meninges? They're going to cover and protect our central nervous system structures. They protect blood vessels and enclose venous sinuses. Those would be like the straight sinus or sagittal sinus and so forth. And they also contain the cerebrospinal fluid within that subarachnoid space that we talked about. And we can form partitions in the skull. So helping with those partitions will be the dura mater. This is, again, the most superficial type of meninge we're going to find, and it's tightly bound to the internal periosteum, except for these three special dural folds here. So this one here that sits within our sagittal fissure or longitudinal fissure is going to be our falx cerebri, and so it really is sitting between those two hemispheres of the cerebrum. Then we have our falx cerebelly because this fold sits between the two hemispheres of the cerebellum. And lastly, we have the tentorium cerebelli, which is going to create a tent over the cerebellum. So it's really sitting between the cerebrum and the cerebellum. That would be inferior to it. And our venous sinuses are going to form at the basis of these three folds. So if we go back to this image here, we can see the falx cerebri here. And of course, up here would have been our superior sagittal sinus. And we have our inferior sagittal sinus and the straight sinus that it's sitting within these areas. And then we have our falx cerebelli down here. Again, it sits between the two hemispheres of the cerebellum along the vermis of the cerebellum. Note too, I forgot to mention this, that the falx cerebri is attaching to the crista galli here, that shark fin looking like structure to hold this in place. And then we have the tentorium cerebelli, so over here in the transverse plane, you could see that it would be sitting between the cerebrum and the cerebellum. So on this side, you could see the tentorium cerebelli has been cut away, and the cerebellum would be sitting right within this pocket. So there's a similar pocket underneath here, and then the cerebrum would be sitting on top of this dural fold. Now let's talk more about the arachnoid mater. Like I said, this is a very thin spider web type of layer. It's a wispy layer. And below it, we have our subarachnoid space that is filled with the circulating CSF. This provides a liquid cushion for the brain and the spinal cord. It's kind of like a little buoyancy type of fluid that we can have here. Now in this area, you might kind of see these little granulations that are present on the arachnoid mater, and these are called arachnoid granulations, which is where the CSF will filter back into the blood. So here's a nice depiction of that. This is our arachnoid mater, and we are going to have the arachnoid granulation villi sticking out, and notice how we have these within the superior sagittal sinus. So we are able to filter some of those contents into the venous sinus so that we can take it back to the heart. And lastly, we have our pia mater. So that you're going to see right along in here, adhered to the brain. It is a thin, delicate connective tissue membrane that is going to follow the contours of the external surface of the brain here. So right along in here. And it's a continuous layer of cells that provides a fluid impermeable membrane. A little bit of a clinical view here on a lumbar puncture. Because our spinal cord doesn't extend throughout the entire length of our vertebral column, we are able to put a needle in through the dura and the arachnoid mater layers so that we can withdraw CSF. If you remember, the conus medullaris ended at L2. So we want to go below that area, maybe, well, typically L4 is where we want to go. And notice how we are in between those spinous processes. And then again, we're going to go through the dura, through the arachnoid mater, and eventually where we want that needle to end is at the subarachnoid space so that we can withdraw CSF. And some other clinical perspective here, some disorders of the meninges. You all probably have heard of meningitis. This is when we have a inflammation of the meninge layers, and it's typically caused by a bacterium or viruses. Bacterial meningitis is typically going to be caused by streptococcus, staphylococcus, or tuberculosis pathogens. And there's, of course, more that we will discuss in a microbiology course. And usually the bacterial meningitis tends to be more severe than a viral meningitis. Viral meningitis is typically caused by enteroviruses, herpes virus, or the West Nile virus. And we could see symptoms such as fever, chills, nausea, vomiting, light sensitivity, soreness of the neck or severe headache, changes in mental state. It can also damage our peripheral nervous structures and cause hearing loss. The way we diagnose it is by doing a lumbar puncture and testing the CSF. Typically, we're looking for bacterial cells when we do that, and treatment, if it's bacterial, is to use antibiotics. Now let's take a look at the ventricular system, since we have been talking about CSF quite a bit. What our ventricles are these spaces within the brain, and they're all connected to one another and eventually to the central canal within the spinal cord. These ventricles, though, are going to be lined by ependymal cells that are going to help secrete the CSF, and these ventricles are going to contain CSF, as we said. So what is CSF? It is going to be very similar to the serum within our blood, but most of the proteins are removed at that point. It'll help to bathe our brain and spinal cord, and it kind of nourishes it and protects it and gives that cushion when we are, let's say, jumping up and down. Now within these ventricles, we have something called a choroid plexus. You can see it highlighted in red in this illustration over here, and its job is to produce the CSF that fills the ventricles. If you look at a close-up of this choroid plexus, you can see that it is lined with those ependymal cells that we talked about. So there's our blank. It's composed of ependymal cells, and they're going to support the tissue, and we also have associated blood vessels. These are going to be little capillaries in which we will pull the contents to make our CSF. Now let's talk about the circulation of that CSF. We are going to start off with the lateral ventricles, which you see over here. This is an anterior view. And if we look at a lateral view, you could see that C shape to these lateral ventricles. And these lie within the cerebral hemispheres and are separated by a wall called the septum pellucidum. So you can kind of see that septum right along in here. Now, in order to have these come together, we are going to go through an opening called the interventricular foramina, and these join the two lateral ventricles with the third ventricle here. Now, note that this third ventricle, when we look at it laterally, there's a little space here that isn't filled, and that is for that interthalamic or intermediate mass that connects the right thalamus to the left thalamus. From there, we are going to go through a little channel called the cerebral aqueduct, and that brings it down to the fourth ventricle. And you can see it has this diamond shape to it, or it almost looks like a triangle in this view over here. And that fourth ventricle is going to be associated with the pons, which you can see right along in here, and the medulla oblongata down over here. The cerebral aqueduct is connected to our subarachnoid space through four structures. We have two lateral apertures, one medial or median aperture, and then we have a central canal that will allow that cerebrospinal fluid to move down around the spinal cord. And here's just another look. So again, lateral ventricles, interventricular foramen, sometimes this is called foramen of Monroe, which brings it to the third ventricle, brings it through the cerebral aqueduct, sometimes this is called the aqueduct of Sylvius, into the fourth ventricle, and from there we have our lateral apertures, a median aperture, and the central canal. Before I wrap this up, the last thing I want to mention is that from these apertures and the central canal, this will move into the subarachnoid space. And so let's go back. We'll just use this image here. So here are our ventricles, right? So they are going to move into that subarachnoid space to bathe the brain and the spinal cord, and then they'll move into those arachnoid granulations that we talked about, and that CSF can then be absorbed into the dural sinuses and will eventually make their way back to the heart, and we start the whole process over again. The heart takes that deoxygenated blood, gets it oxygenated, sends it up into these capillaries. From the capillaries, we create CSF, and it travels through the ventricular system, and the whole cycle happens over again. So just wanted to kind of complete that picture for you. Now for another clinical view, let's talk about strokes. This is a disruption within the blood supply to the brain and can be caused by a blockage of any artery to the brain, whether it's a blood clot, a fat embolus, or an air bubble, or a break in the artery causing a hemorrhage. So with any of those, we're going to have a lack of blood supply. And so the brain tissue then becomes deprived of the oxygenated blood and will starve from a deficit of oxygen, and the tissue will start to die. The result is loss of specific functions. Now, you may have heard of transient ischemic attacks, or TIAs, which is also called a mini stroke. This is when we have a physical blockage that may be temporary, cutting off the blood supply to the brain. So you might have some symptoms of a stroke, but then the patient will recover. It's dependent on the speed of treatment, and we can use what's called FAST as an acronym to remember what to look for in sudden loss of neurological function. F in FAST is for face, so we're looking for the muscles and making regular facial expressions. A is for arms. Can the person raise their arm above their head or lift just one? S is for speech. Are they slurring their words? And T is for time. You want to call for help as soon as you see any signs that may be a stroke.